G'day, Darren Earnshaw here from Maitland Australian Physiotherapy Seminars. Just wanted to put a little video up on a patient that I saw yesterday, the diagnosis chronic regional pain syndrome. And after the assessment, that's exactly what she appeared to have. And I'm not going to talk about the specific treatment approach, but it got me to thinking that a lot of people might say, well, she's not really a Maitland patient, is she? She needs a different approach, not passive movement being the primary thing. And I just wanted to emphasise with this video that Maitland is not just a manual therapy passive movement system. That's part of the system. And we have a unique way of going about the way we develop a manual therapy treatment technique. But the complete system is a clinical reasoning system that can tackle anything that walks into the clinic. Maitland, you can see old videos of him talking about this. He emphasised that you need to think about the way you think. He was probably one of the original guys in physical therapy to emphasise this. Obviously not the original guy in life. There are plenty of philosophers who say that you should think about the way you think, etc. But Geoff Maitland was probably the first guy to do this, and he emphasised a very non-dogmatic way of thinking. He was quite happy to say, I don't know everything, and change with the times, which means that with my patient yesterday, where I did not do a manual therapy approach and did more of a education, I'm going to set a very specific program, we're going to use mirror therapy, all these things that you can use with these sorts of patients, they would fit into his system, because he would be the sort of guy, if he was alive today, would be embracing all these new approaches, etc., and utilising them on the right patient. And working out what your patient needs is clinical reasoning. Now, we utilise clinical reasoning sheets based off hypothesis categories that are a tool to make you improve your clinical reasoning and improve your lateral thinking, because a lot of people are very vertical thinkers and they find it difficult to think this way. We have a tool that you can basically utilise after you've seen a patient. You run through this clinical reasoning sheet, you do enough of them, you'll become a pretty expert clinician. Anyway, if you want to learn more about it, come and do a course. Those of you who've done our courses would be nodding your head as I speak. Just to emphasise, Maitland is not manual therapy, Maitland is clinical reasoning, and even more so, Maitland is a way of thinking. Thanks, hope that helps. See ya.